For years, millions of seniors relied on Medicaid without thinking much about it. The card worked, prescriptions were covered, doctor visits went through. Everything felt stable. Then quietly, things started changing, not with some dramatic announcement, not with a phone call warning families ahead of time, just small notices, letters, renewal requests, verification forms. And for many seniors, those changes didn't feel urgent at first, because the coverage had always been there before. One legal aid worker in Texas described speaking with a woman in her 70s who had no idea her coverage had ended until she arrived at the pharmacy and was handed a bill for more than $900. She thought it had to be a mistake. Nothing in her life had changed. Same income, same address, same doctors. But somewhere inside the system, her case had been flagged for review, and she never realized the paperwork deadline had already passed. That's the part many families still don't fully understand. A lot of these coverage losses are not happening because seniors suddenly stopped qualifying. Many are happening because the system itself changed back into renewal mode after pandemic protections ended. During the pandemic, Medicaid programs were largely prevented from removing people from coverage, but once those protections expired, states suddenly had to review millions of cases again, all at once, and in many places, the system simply wasn't ready for that. Renewal notices started going out. Files started reopening. Old addresses created problems. Verification requests piled up. And sometimes, seniors didn't even realize their case was under review again until coverage had already stopped. One unopened envelope, one missed form, one delayed response. That was enough. And what made the situation worse was how quietly everything happened. No dramatic warning, no obvious emergency, just confusion that slowly turned into consequences. Some families only realized something was wrong after prescriptions stopped processing. Others found out during doctor visits. Some discovered it weeks later when medical bills started arriving unexpectedly. And for older Americans already dealing with health issues, fixed incomes, or daily stress, even small interruptions can quickly become serious, especially when the system doesn't slow down to make sure people understand what changed. But losing coverage quietly was only the beginning. Because for many seniors, the next problem started after they tried fixing it. At first, many families assumed the problem would be easy to correct. Just call the office, send the paperwork, clear up the misunderstanding. Simple. At least that's what people expected. But this is where things started getting more complicated. Because once millions of renewals restarted at the same time, delays began building almost everywhere. Phone lines became harder to reach. Processing times stretched longer. Offices became overwhelmed. And for seniors trying to navigate all of this alone, even small delays started turning into real problems. One volunteer in Florida described helping an older man who mailed his renewal documents on time, but the system never marked them as received. Weeks passed before he realized there was an issue. By then, his case had already been closed, not because he was ineligible, not because he ignored the request. The paperwork simply never moved through the system fast enough. And this is where many people get blindsided, because the system often reacts automatically. A missed update, a delayed verification, an address mismatch, just a small status change inside a file. But for the person affected, it can suddenly mean losing access to prescriptions, appointments, or care they've relied on for years. One advocate described seniors spreading paperwork across kitchen tables late at night, trying to understand letters filled with deadlines, verification requests, and instructions that didn't always make sense. Some forms arrived late. Some notices went to old addresses. Some people thought they had already completed the process. And many didn't realize anything was wrong until they tried using their coverage again. That's when the panic usually starts, not during the paperwork, during real life. At the pharmacy counter, at the doctor's office, at the hospital billing desk. That's when people hear the words, "Your coverage is not active." And in that moment, everything else stops making sense. Because most families still believe these systems work slowly enough to give people time to fix mistakes. But often, they don't. And in some cases, seniors are losing coverage even when nothing about their actual eligibility has changed at all. Which raised a much bigger question. Who was getting hit the hardest? And this is where the situation started affecting some groups far more than others. Not because they did anything wrong, because small system gaps hit certain people harder. Seniors living alone, people with memory problems, older adults dealing with chronic illness, families already overwhelmed with caregiving responsibilities. For many of them, even keeping track of paperwork can become exhausting. One missed notice doesn't always feel urgent at first. That's the danger, because these systems rarely fail all at once. They fail quietly. A delayed form here, an address problem there, a phone call that never gets answered. Small gaps, but eventually those gaps start connecting together. One advocate described older adults leaving important letters unopened for days simply because the paperwork felt overwhelming. Not refusal, not ignoring the process, just confusion. And confusion becomes dangerous when deadlines keep moving forward anyway. Some immigrant seniors faced even bigger challenges. Language barriers made notices harder to understand. Instructions felt unclear. Verification requests became stressful to navigate. And in nursing homes or assisted living facilities, families sometimes assumed someone else was already handling the renewal process. Then suddenly, coverage problems appeared without warning. And once coverage disappears, fixing it is rarely immediate. That's the part many families never expect, because people assume that once documents are submitted, coverage quickly returns. But in many cases, there are delays, backlogs, reprocessing steps. And during those gaps, real life keeps moving. Doctor appointments don't stop. Prescriptions don't pause. Medical needs don't wait. One caregiver described realizing something was wrong only after a routine prescription suddenly came back with a massive out-of-pocket cost. That was the moment everything changed. Because now this wasn't just paperwork anymore. Now it was affecting decisions about health, treatment, and daily life. And for many families, losing coverage turned out to be only the first problem, because restoring it could become even harder. Losing Medicaid is not where the problem ends. For many families, it's where the real pressure begins, because once coverage disappears, even temporarily, the financial consequences can start building fast. Some seniors suddenly find themselves paying out of pocket for medications they've taken for years. Others delay doctor visits because they're afraid of unexpected costs, and some families start making impossible choices almost immediately. Do they pay for prescriptions, medical appointments, utilities, food? That's the gap people fall into. Not fully covered. Not fully uninsured, just waiting for paperwork to process, waiting for updates, waiting for someone to answer the phone. And in many places, those waits are becoming longer. One former Medicaid worker described how reinstatement systems are now struggling under growing backlogs, which means even seniors who still qualify can spend weeks waiting for coverage to return after fixing an issue. And during that time, life doesn't slow down, bills keep arriving, medical needs continue. Stress keeps building. One woman described feeling like the system had simply disappeared while she was still trying to follow every instruction correctly. That uncertainty becomes exhausting, because people stop knowing what's covered, what isn't, whether appointments should be canceled, whether prescriptions will go through. And many families don't realize how fragile the situation is until they're already deep inside it. Some seniors begin skipping medication to stretch what they have left. Others postpone treatment, hoping coverage returns before something gets worse. And the longer delays continue, the harder it becomes for families to feel stable again. But what made the situation even more confusing was that not every state was handling these problems the same way. Because it's not the same everywhere. Two people can have almost identical situations and still experience completely different outcomes depending on where they live. Some states moved through renewals faster. Others struggled with growing delays and staffing shortages. In certain places, families reported receiving updates quickly. In others, people waited weeks just to hear whether paperwork had even been processed. And from the outside, the system still looked the same. Same forms, same deadlines, same coverage programs. But inside the system, the experience could feel completely different. One advocate explained it this way. It's not just speed, it's clarity. Because in some states, families understood what was happening. In others, confusion became part of the process itself. People weren't always refusing to respond. They weren't ignoring notices. Many simply didn't understand what the system needed from them before deadlines expired. And once delays start building, everything else slows down too. Status updates, case reviews, reinstatement requests. Weeks can pass while families are still trying to figure out what changed. And many people don't realize there's a problem until they try using their coverage again. That uncertainty becomes its own kind of stress. Doctor appointments become harder to schedule confidently. Prescriptions feel uncertain. Every letter suddenly feels important. Because families stop trusting whether coverage is actually active anymore. And once delay turns into a real coverage gap, the consequences start affecting everyday life very quickly, which leaves many families asking the same question. What are people supposed to do while they're stuck in that gap? For many families, that question still doesn't have a clear answer, because these systems are complicated even when they're working normally. And right now, many seniors are trying to navigate changes that are happening quietly, quickly, and sometimes without enough clarity. Forms, updates, reviews, rechecks. One small mistake can suddenly create much larger consequences. And often, people don't realize anything changed until real life forces them to notice. At the pharmacy, at the doctor's office, when a bill arrives unexpectedly, that's usually when the situation becomes real, not when the notice arrives, when coverage stops working the way families expected. And the hardest part is that many seniors believe they were still protected the entire time. That's why staying informed matters more now than ever, because small system changes can affect people in very big ways, especially older adults already dealing with health problems, financial pressure, or daily stress. If this video helped you understand what's happening, subscribing helps you stay aware of changes like these before they turn into bigger problems for families. And by the time many people realize something changed, the consequences have already started.